I'm Angenette Levy, and you are listening to Simply Medicine on 55 KRC, the talk station. We've heard a lot over the last several months about people feeling hesitant or reluctant to get the COVID-19 vaccine. People are just kind of fearful. They have a lot of questions about it. Maybe they think it was produced too quickly. Maybe they're thinking about things and reading things on the internet. So joining me to talk about this important topic is Dr. Maria Espinola. She is an assistant professor in the Department of Psychiatry at the University of Cincinnati, and she's also a licensed clinical psychologist. Dr. Espinola, thanks for joining us here on Simply Medicine.
Of course. Thank you for having me.
Talk to us a little bit about what is the root of this hesitancy, this reluctance, this fearfulness about getting the COVID-19 vaccine?
Yeah, I think a major factor is the misinformation. We deal with an epidemic, which was COVID, and also we have the epidemic of misinformation that keeps harming communities. So that is definitely one factor. Another factor is marginalized communities who have felt that hospitals or medical providers have been hostile to them in the past, or who haven't provided proper care, or people who have felt discriminated or mistreated. They are also have more hesitancy on trusting again. So that's another major issue. Another one is just barriers that people face every day because of poverty, lack of transportation, having to need someone to provide childcare while they go and get the vaccine, or having to work multiple jobs. So there's just a lot of factors that come together that are preventing a lot of people from getting the vaccine.
And you have been focusing on largely Latino communities. Talking with somebody the other day who told me that the Latino communities are one that has like the lowest vaccination level or lowest level of vaccinations. Is that the case?
Yeah, that is definitely one of the main groups. Mm-hmm.
And tell me why that is. Why in the Latino community has there just not been enough outreach? You know, you see places and you see that there's information in Spanish, but is it not reaching the communities, the information, or is there misinformation spreading in the Latino community?
There is definitely a lot of misinformation being spread, and it's not being regulated in the same way that information in English is being regulated. So that has been a huge problem. And that is coming from the internet. And also we have heard from religious leaders as well. So we have heard that at least one or a few religious leaders, at least one pastor and one priest, is just telling people not to get the vaccine, discouraging them, from getting the vaccine. Mm-hmm.
Is this like a Latino pastor or member of the clergy?
Yeah, unfortunately, yes.
Is he prominent or something? This is very interesting. I know I see you're not saying this person's name, so you probably don't want to just like throw them out there under the bus, but is this person a prominent clergy member?
Yeah, definitely influential. So that has been a huge problem for us.
So is he Catholic or some other denomination?
So there are at least two. So one Catholic priest and one pastor.
And they've been telling the Latino community not to get the vaccine.
Yeah, and with like some stories about like the vaccine leaving the devil's mark and so complete stories like that, that are really hard to, because generally Latinos tend to be pretty religious, so they follow what their religious leaders are saying, and that has been very difficult for us.
We're here talking with Maria Espinola. She is a licensed psychologist. She's also an assistant professor of psychiatry at the University of Cincinnati. So, Dr. Espinola, you have members of the clergy, Latino clergy and press, you said, and they're telling people, members of the Latino community, not to get the vaccine because it's leaving the mark of the devil or whatever, which that sounds like something that would have happened, 150 years ago, not today. But what are you guys doing to combat that? Or what is your message to the Latino community? Because obviously, if you have people in the Latino Hispanic community who are very religious and they trust these people, they're getting a message that is contrary to all of the medical evidence.
Absolutely. Yeah. So we have reached out to many religious leaders, and we're partnering with them in delivering different messages. So I'm part of the Latino Health Collaborative. And this is a group of about 70 people. It's a mix of providers and community advocates. So several of us have reached out to religious leaders, and we have collaborated in conferences. We have also had them feature in videos, educational videos. So that is helping. That is definitely helping. I'm a member of the Latino Faculty Association at the University of Cincinnati. So I have collaborated with Latino physicians from different countries in Latin America to deliver the message, because it's generally people respond better if they hear a doctor from Latin America, from the country that they're from, say something, they are more likely to trust that person. So that is definitely, we are trying to be as creative as possible. And we are collaborating with Anthony Munoz, Hall of Famer, former Cincinnati Bengals player. He's helping us spread the word. We're here to create community. We're here to promote wellness and happiness. So hopefully that will help people feel more at ease about getting the vaccine.
Well, that sounds great. Dr. Maria Espinola talking about vaccine hesitancy in the Latino community and just in general. So we appreciate you coming on to talk with us about this topic. It's an important one. Obviously, we want all the right information out there about the vaccine, good, bad, or whatever. So thanks again for joining us.
Thank you. Thank you for having me.
I'm Angenette Levy, and you are listening to Simply Medicine on 55 KRC, the talk station.